The project is on schedule. We're within budget, and things are progressing on schedule. I will say that each day that goes by, the anxiety increases, which is natural, I think, with any project that has quite strict timelines. It's like a domino effect, so if one process isn't completed timely, it will affect the other process. And sure. I think the big challenge for us will be to finish all of the steps so that licensing can come in and do what they need to do, because we can't house patients if the facilities aren't licensed. When you look at it from the exterior, it doesn't look a whole lot different than it did in December. What is significantly different are the inside of the buildings, and you're seeing them now stocked with equipment, with modular furniture, in some cases some furniture. You got to give credit to the team that really developed this project, because there was a ton of forward thinking. It would have been really easy to stay inside of that box and say traditional prisons look like this, we have to build it this way, and then we have to fit the medical mission in that. They went the opposite. What are we trying to achieve? How can we provide the best healthcare program, healthcare facility, keeping in mind all the needs of the inmate patients, and then build a prison around it that will meet the public safety requirement. Primary placement will be for high acuity and low acuity medical, and then the mental health patients with acute care, or acute level of care needs, and intermediate care level of needs. Within that population will be high security inmates, medium security inmates, and low security inmates. With this project, we have every intent on being a good neighbor in the community. We want to be able to give back. We're gonna create a couple thousand jobs in the community. The Department of Corrections has gone through 3 waves of layoffs, and the receivership gone through their first wave of layoff. Many employees are being placed or given opportunities to continue their employment at this facility when they may have been laid off. So we are not just receiving inexperienced staff. There are challenges every day. It's at times been frustrating. At times it's been very exciting when you start thinking about the inmates arriving and staff coming on board and implementing these policies that we put so much effort into. At times it's a bit overwhelming. There's so much at stake here, and there's so many people that have taken ownership in this project that it's not going to fail.